Hi, I'm Richmond Heath. I'm a physiotherapist and I've been specialising in trauma recovery and resilience training for the last 12 years. Because I'm coming from a body-based background and I'm looking at PTSD from the perspective of movement, I'm able to offer a very different view of PTSD than most people currently working in the field. In this presentation, I'm going to show you how the neuromuscular system and movement are missing pillars in our current approaches to PTSD, and how we can use a very specific form of spontaneous involuntary movement, not only for early intervention and the self-management of PTSD at subsyndromal levels, but to help prevent PTSD in the first place. Now, we already know that PTSD is not simply a psychological condition, but is a full systemic disorder affecting all the systems of the body and leading to somatic comorbidities and chronic disease as well. In order to make sense of this, we have to understand how polyvagal theory has revolutionised our understanding of the autonomic nervous system, showing us that our body's neurobiological responses to stress and trauma occur in three very distinct phases: social engagement, mobilisation, and immobilisation. When we chart these responses on a graph, the first thing we notice is our body's response to stress and trauma is first and foremost about movement. Either the calming of movement to allow for relaxed communication and calm body language, the creation of movement during fight or flight responses, or the containment and inhibition of movement during the immobilisation or freeze response. This defence cascade is not only behavioural, however, it also occurs in the neurobiology of the body, as our nervous system, cardiovascular system, and hormonal systems also follow this cascade in order to fuel our body's instinctual responses. Now, while existing research into PTSD has historically been biased towards cognitive behavioural therapy and pharmaceutical treatments, the bridge between our internal biology and our external behaviour is our neuromuscular system and the movements it either creates or contains in response to stress and trauma. It's crucial to recognise these defensive responses are not a cognitive process, but are generated subcortically and primarily outside our cognitive control. Now, doesn't it make sense that if the human body has evolved with instinctual reflexes to take us into these defensive states, it would have also evolved with similar subconscious reflexes to take us back out of them afterwards? And this is exactly where the neuromuscular system and spontaneous involuntary movement fits in. In this video, you'll see a dog shaking because it's been left alone tied up to a bench. When we see this shaking, we generally assume it's simply a sign of stress and anxiety. But ask yourself this question: what is the shaking actually trying to achieve for the neurobiology of the body? You can see how the shaking relaxes and dissipates the flight response and calms the dog back down. These shakes and tremors are referred to in the literature as unclassified therapeutic tremors, but are more commonly known as neurogenic tremors because they are generated spontaneously by the nervous system below the level of cognitive control, releasing the immobility response, relaxing muscular tension, dumping adrenaline, and downregulating the autonomic nervous system. Not only restoring the capacity for relaxed movement in the neuromuscular system, but calming our neurobiology and relaxing our behaviour as well. Animal research is already well aware of how neurogenic tremors release our body's survival states, shown here by an Arctic squirrel shaking out of hibernation, where the body initiates neurogenic movements below the level of conscious awareness and before the animal is even awake, releasing the suspended animation of deep immobilization, downregulating the nervous system through spontaneous movement, and restoring the neuromuscular system and the neurobiology of the body along with it to a calm, relaxed, and vital state. Many cultures already recognise the role of these spontaneous movements and deliberately use them for their health and well-being. To name just a few, the Kalahari Bushmen refer to themselves as the keepers of the shake. Bioenergetic shaking is widely used in Indonesia, and Katsujun Undo, or regenerative movement, is a martial art practiced in Japan. In Australia, Olympic athletes and AFL footballers are also using this tremor mechanism to help improve their recovery and performance. But in our current psychological models of PTSD, and without any research into this phenomenon whatsoever, these spontaneous movements are pathologised and stigmatised as a symptom of panic attacks, social phobias, generalised anxiety disorder, and PTSD. Many people are even put on medication to prevent this natural shaking response, inadvertently inhibiting the specific mechanism the body is seeking to activate in order to initiate its recovery. In Western cultures, we also misunderstand these movements and suppress them as a symptom of shock, trauma, loss of control, and anxiety, even though they are obviously not contributing to our fight, flight, or freeze responses in any way. As the body is seeking to downregulate through spontaneous movement, it's no surprise that muscular tension and bracing are required to inhibit it, and when left unresolved, contribute to the chronic muscular tension associated with stress and trauma and the somatic comorbidities that accompany PTSD. With the neurobiological pathway to recovery no longer available, the nervous system has little choice but to oscillate between states of hyperarousal and immobility, with substance abuse and compulsive behaviours the only option to avoid the discomfort of living with a chronically dysregulated nervous system, unable to ever fully switch off or relax. And it is this swinging between states of hyperarousal on the one hand and numbness and disconnection on the other that is the very definition of PTSD. PTSD, however, is not the only outcome of these chronically activated states. While psychological models differentiate disorders based upon their symptomology and external behaviour, it is the underlying neurobiology of the body that is common to all the conditions people commonly experience in the aftermath of stress and trauma. Key research conducted by Dr. Arya Shalev almost 25 years ago has shown that when we are able to downregulate the neurobiology of the body immediately after a traumatic event, we are highly unlikely to develop PTSD. And conversely, when we are unable to switch off our neurobiological response immediately after a traumatic experience, we are highly likely to develop PTSD. It's helpful to recognise that all the symptoms we associate with PTSD are signs the neurobiology of the body is habitually reactivating defensive responses, even though they are no longer helpful or required. From the hypervigilance, insomnia, and domestic violence of fight and flight responses to the withdrawal, addictions, and depression associated with the physiology of freeze and fold. Even suicide can be seen from a neurobiological perspective as a final effort to escape what has by then become an insurmountable internal stressor. Parallels for this process of chronic activation and incomplete discharge also exist at the cellular level, where groundbreaking research into the cell danger response has shown cells also get stuck at specific points in their recovery cycle, effectively functioning in a state best described as cellular PTSD. And just as the habitual state of our nervous system determines which psycho-emotional or behavioural disorders we are likely to develop, the stage that cells get stuck in their recovery cycle also determines their resultant pathology and the kinds of chronic disease we are likely to develop in later life as well. We already know movement and exercise play a crucial role in calming our nervous system and recovering from PTSD. A meta-analysis has shown that body and movement-orientated interventions appear to be effective in reducing PTSD symptoms, and groundbreaking Australian research demonstrated the addition of an exercise program significantly improved the effectiveness of traditional treatment approaches. While exercise is well known to be just as effective as medication in the treatment of mild to moderate depression, TRE founder Dr. David Berceli demonstrated there are significant additional effects on the nervous system when we incorporate neurogenic movements in comparison to using volitional movement or cognitively directed exercise alone. Many trauma therapies already use movement or its stimulation as their entry point to balance the autonomic nervous system, with EMDR's replication of the involuntary eye movements of REM sleep one of the most obvious and relevant examples. While both the Tomatis method and Stephen Porges' Safe and Sound protocol use sound to regulate the autonomic nervous system, it's important to recognise that their point of influence is through the restoration of healthy tone and normal movement in the muscles of the inner ear. Vagal nerve stimulation, whether internally or externally, is showing promising results in regulating the nervous system, while the PONS device, used to retrain the functional neurology of movement and balance, uses a tiny stimulation to reawaken the nervous system's own innate capacity for neuroplastic change. Now, if all these treatments are having their impact by stimulating cranial nerves, doesn't it make sense that stimulating what is effectively the largest nerve input into the brain, the spinal cord, Using the largest sensory input into the nervous system we have, the feedback coming from the movements of our muscles and their associated fascia, is also likely to have a profound impact on the autonomic nervous system and our general health and well-being. This is precisely what the trauma-informed self-care technique TRE does, invoking the body's innate capacity to remodulate the autonomic nervous system through spontaneous neurogenic tremors and movement. While involuntary, the movements are able to be self-regulated, providing a simple technique to help address the neurobiology of PTSD. Easily integrated into exercise and recovery routines, TRE can be used alone or in groups to help calm the nervous system, improve sleep, and support and enhance the effects of traditional top-down treatments. As the body itself generates the movements and the technique does not require mental focus, physical effort, or the need to recall or talk about past events, it is stigma-free and easily accessible when people are most fatigued and least likely to use more demanding self-care practices such as mindfulness or general exercise. Around the world, evidence for this novel approach is emerging. To provide a few examples, US Veterans Affairs are in the final stage of a 3-year clinical trial using TRE for the treatment of PTSD, while peer-reviewed research has demonstrated TRE is highly feasible as a self-care technique to improve quality of life among non-professional caregivers. Research and a case study published in Australia have shown improvements in the capacity to cope with stress and a reduction in restless leg syndrome, one of the most common neurobiological comorbidities of PTSD. At the individual level, wearable technologies that measure heart rate variability and sleep quality clearly demonstrate the immediate impacts that neurogenic tremors have on calming our nervous system. So it's no surprise that frontline health workers and survivors of natural disasters consistently evaluate TRE as more effective than other forms of resilience training they have done, reporting immediate calming effects, being highly likely to continue using TRE, and almost unanimously recommending the training for other people affected by chronic stress and acute trauma, including natural disasters. The sad fact people affected by PTSD continue to take their own lives in record numbers, and the bleak reality that 2/3 of people affected by PTSD will not reach full recovery using our existing evidence-based practices demonstrates a key knowledge gap in our understanding of PTSD and an urgent need to explore novel neurobiological approaches such as the deliberate use of neurogenic tremors. But rather than continue to focus on treatments for PTSD after the fact, we need to develop new approaches to help prevent PTSD in the first place. Providing people with a neurobiological model of PTSD as outlined in this presentation, and a simple technique like TRE to help address it, is equivalent to providing people with a form of trauma inoculation. And just like any vaccine, while not 100% effective, prepares our body to respond to stress and trauma more effectively and enhances our capacity to resolve it at subsyndromal levels before developing into a full mental health condition. It's also worth noting that post-traumatic growth can only truly occur when the neurobiological responses to stress and trauma have also been resolved, and that the neuromuscular system's response to perceived threats to our sense of self and identity is almost identical to the way it responds to threats to our physical body. This doesn't mean that neurogenic tremors are the panacea to PTSD or any other mental health condition, but when used in conjunction with traditional top-down approaches, they have the potential to significantly improve our existing treatment outcomes. Specifically designed to empower large populations in their recovery from mass-scale trauma, TRE is evidence-informed and has already been learned by an estimated 5 million people, with professional trainings in more than 70 countries around the world. If you'd like to explore the process for yourself, or you know people who might benefit from a simple self-care technique to support their mental health and physical well-being, you can learn TRE online for free through a self-guided learning course at trecourse.com. We know PTSD is not simply a psychological disorder, and that our existing treatment approaches are not doing enough to help people prevent PTSD. So it's crucial we incorporate the neuromuscular system and neurogenic movement in our efforts to understand and overcome this debilitating condition. Neurogenic tremors, whether invoked through TRE or any other spontaneous movement practice, provides people with a practical process they can use on their own to help address the underlying neurobiology of PTSD and maintain their somatic hygiene in the face of chronic stress and acute trauma. It's a missing pillar in our current approaches to PTSD, and I hope this presentation inspires you to investigate it further.